Over the past years, expiratory central airway collapse has gained a lot of attraction to our patients, to our readers. And here in Mayo Clinic, Florida, we're a very active center to treat patients with this pathology. Hi, I am David Avia. I'm one of the interventional pulmonologists at Mayo Clinic, Florida. And I wanted to introduce you to our newest article called Expiratory Central Airway Collapse and Pneumatic Stenting with Continuous Positive Pressure Titration, a technique description. This is an article that we created to describe step by step how do we do a dynamic bronchoscopy. Over the past years here in Mayo Clinic, Florida, we've accumulated a substantial amount of experience in these procedures, the dynamic bronchoscopy. And we know that CPAP has been an alternative therapy for these patients, but in the literature, there's real no guidance on how to do it. A dynamic bronchoscopy is the gold standard technique to diagnose this entity called expiratory central airway collapse, which is also known as tracheobronchomalacia, or at least commonly called like that. It's an airway disease in which the central airway, meaning the main air pipe, left side and right side, become floppy, and they can collapse when patients breathe out or when they cough. These can typically behave as shortness of breath, coughing, or frequent infection. As you guys can see in this video, here we are doing the dynamic bronchoscopy. We have a special light to indicate when the CPAP pressure was properly titrated to keep the airway open, and when we remove it, you see the airway collapses again. This is one of the several tools we can use to treat this condition and hopefully stabilize patient symptoms. The real frequency of this entity is unknown, but usually we see it in patients that has gone through multiple providers, multiple subspecialties, multiple clinic visits, and they still don't have explanation for this type of diseases. You know, expiratory central airway collapse often is a common cause of this. Hopefully, this article can increase the amount of research all the centers can do. It can serve as guidelines on how to do it and hopefully standardize this practice. Here at Mayo Clinic, we are one of the few centers that have a substantial experience in this expiratory central airway collapse, and we can help our patients, and we'll continue pushing the edge to try to find the answers you guys need. If you are one of these patients that is out there and do not have explanation for your shortness of breath, cough, or frequent infections, here in Mayo Clinic, Florida, we can help you with it. We have a very specialized team to tackle this entity, and remember that for us, your needs as a patient come first. We invite you again to read our articles. Hopefully this can, bring up some new ideas, and we can collaborate in future research once we achieve standardization of this pathology.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.